Right here at C6. Gonstead said there's almost I think he said like a 90-some% correlation with an inferiorly tipped cervical vertebrae and subluxation. And you can clearly see that on the instrument right where that's reading. Okay. All right. Bear with me, Allison. Allison, more tender here. I'm going to go down to here. About the same? Okay.
Yeah.
Here. I'm going to check your SI joint here. So I'm going to feel for motion restriction. Lift that right side 90 degrees. And left side. And right side. And left. So the left side's moving better. The right side's still moving. It's still slightly locked. Lift your right leg again. 90 degrees? Okay. March in place, please. And stop. So the glute on your left side is lower. It's indicative of PI, and it's flatter on this right side here. And on your x-ray, when the hip rotates internally, on that right side there, the hip starts to rotate internally, you'll start to see less of that obturator. And that's why this one on the left side appears much greater than the one on the right side there. So we're going to start with that ilium. We're going to set that first and then see if we need to come back and set L5 because that's also posterior. So if you would please lie down. One of the other thing that's very consistent on an internally rotated ilium is that it does tend to raise the femur head on that side. And this is another reason why the ASI and ilium is associated with damage to the hip joints. Your hips look really good. There's a lot of space in there, but there's still a lot of rotation. We're going to take care of that.
Huh.
And breathe out. Okay, good. Right back. Right side. Left. Right side. So now it's moving more like the left joint there. That's a good adjustment. Talking about before is when the vertebrae is shifted in the neck, they subluxate inferiorly. They shift downwards. And it's just because of the angle of facet, and that's what starts to pinch off that nerve. C6 very clearly wedging backwards here, much wider in the front of that. But the other thing that you'll note is the wear pattern above it. Like for instance, C5, it starts to, because it has to move more, since C6 is locked, C5 will move more and it starts to wear out the disc space more there. So anytime you have arthritis on virtually any joint, it's never the joint that's the problem. It's always compensating to something else. Just like if you damage your left knee and you start limping around on your right knee's not the problem, it's the one that's damaged. So let's. Okay, perfect. Right back, we're going to go right over those areas where we found interference, and that's very clear out there at C6 is right to 0. And then down here, see, I'm still finding pressure down here. So this is still off the chart there. So we're going to come right back and we're going to set that fifth lumbar and clear that out. And breathe out. Okay, nice and gentle. I'm going to go right back at that location there. And that's at L5 there. Okay. Your complaint when you came in, low back pain. It's messing up your working out, and you got to take care of these grandkids here and throw them around a little bit. How you holding up? I know it's only been a few visits. How you holding up?
Yeah, well, there's no pain anymore. And I have had issues before, like a year ago. And that's when we had been moving, we were doing remodel work, and we were moving all of our furniture out, going downstairs, and I was carrying big boxes down the stairs, and I think I was reaching out and carrying heavy weight. So it seems to be like if I'm don't know,
Mhm.
reaching out and then
Mhm.
maybe not using my legs as much as I should be. So it's my back that feels it.
Mhm.
So I had physical therapy and that seemed to help, but then this happened again and I don't feel like I was doing anything, I don't do heavy weights.
A few things here just to note is everything you're saying is very common. The majority of stress on the discs, hence the nerves, is in the spine flex position like you are now. The position that you go in and bend. And when you're bending forward, now you have even more of a law of physics disadvantage back here. It's the lever's longer, so you're putting more stress on this joint. So just because you didn't notice anything at the time, you could be risking injury, and all of a sudden now you get to the point where you just bend over to brush your teeth a little bit and you get locked up. So that's very, very common. The second thing is PT is fantastic for muscle issues. As a matter of fact, there's nothing that comes close to a physical therapist. But when it's a disc and a nerve issue, it's like putting a square peg in a round hole. That ain't gonna work. But the other thing is, now you just have to start modifying the things you do. People that have nerve and disc injuries, they can certainly do everything that they want. They can go back to lifting. They can go back to lifting heavy. It's just you got to be careful what you do. Most people are better off doing single leg work like split squats and lunges instead of putting in this position. And unless you're a professional athlete and making a living off doing heavy lifts, for most people it's probably not the best thing for it. But you're doing great and you've been consistent, so you're going to keep getting better and get back into the gym and hang out with the kids.